When a patient finally decides, I need some help, I'm going to go see a stomach specialist, how do you decide if you need to start working on food they eat, how much they eat, or whether you need to get a scope to look down and see what's going on down there and do a colonoscopy to see what's going on? I would think you almost have to do everything to rule out.
I think you try your best to not over-test people who have IBS, because testing doesn't make anybody better. It sort of makes them frustrated that you don't really know what's going on. So what you do is you first take a good history and physical exam and try to see, does this fit the irritable bowel syndrome or not?
More common in women or men?
Women for sure, but it's really not that more. It's more equal than it is more women.
Certain age 30 to 40, 40 to 50, age 20?
IBS almost always starts in our youth and goes up throughout the rest of their lives. IBS is not curable, it's there forever, but it really does wax and wane throughout our lives. There is something, however, called post-infectious IBS that can happen really any time in our lives.
So after you get a GI infection or after you get a head infection?
Usually a GI infection, and it sort of sensitizes the bowel to make it irritable.
So if you get an infectious diarrhea, or if you get an infection somewhere, you may be left with an overactive, oversensitive, overregulated, over-dominating GI.
That's
it must
exactly
be terrible.
Right. It is, but part of the reason you see a doctor is for them to reassure you, to go through, and if need, and if there's a fear of colitis or colon cancer, to maybe do that colonoscope to say, no, it's not that, it's just IBS. And I think patients know what to do, they just need some help sometimes.